to Hip Hygiene for today's orthodontic patients. I don't know if many of you know, but I've had braces 3 times in my life. Yes, not once, not twice, but 3 times. And in my day, traditional braces were really the only way to go. But today, patients have so many opportunities, such as lingual braces, Invisalign. So I want to kind of compare and contrast traditional braces versus Invisalign today and give you some tips for your patients to help encourage hygiene. One is the reason for Invisalign, I think, really came out of aesthetics. They're virtually invisible. They're clear retainers, and you try to wear them as much of the day as possible, right? They're a little bit more comfortable. You don't have to have wax covering all of your teeth just so that you can talk and function like I had to. You can continue with your regular diet. Back in my day, I wasn't able to eat a lot of different things. Popcorn, really chewy candies, things that were really tough or hard. And I can't tell you how many brackets I've lost to apples or celery or carrots or things that are healthy, but they were just really hard and I snapped my bracket off. And lastly, oral hygiene is much easier, but I want to give you this other idea. Is it really easier? You know, with traditional braces, I used floss threaders, water picks, electric toothbrushes, rinses, fluoride mouth rinses. So I had to use a lot, and it was a chore for me to have hygiene. And today with Invisalign, it's a lot easier. You don't need floss threaders. You don't really need water flicks. You just need a traditional old toothbrush, preferably electric, some toothpaste, and some floss. But one aspect to Invisalign that I think people need to realize that you actually have to take your retainers out when you eat and brush your teeth right after before you put them back in. And so that's basically maybe before you're only brushing 2 times a day. Now you have to do that 3 times a day, and you have to take it with you. Let's say if you eat lunch out or if you eat lunch somewhere else. And so that's an aspect that I think is really important in going over. And so let's go over great hygiene techniques. Is 1, brush and floss daily. If you have traditional braces, 3 times a day would be great, but sometimes you only make it 2 times a day. And with Invisalign, you do have to take your retainers out, brush your teeth, rinse, and then put your retainers back in after you've done so, right? And so you're doing your job on a daily basis. But on top of that, number 2, you have to go visit your dentist. It's really important to visit your dentist because you want to make sure that everything's moving along in the right way. And you want to check in with your orthodontist and make sure that your hygiene's good. What you want to catch early is if there is an incipient carious lesion or a white spot lesion, or if you have gingivitis or something like that because of complications and the fact that your mouth just has a lot more stuff in it and it's harder to clean. And so they're going to be able to give you a really good idea of where you are, and they're going to help guide your treatment. And so having regular appointments is really important. Lastly, number 3 is that you have to make hygiene fun. Back in my day, we actually got coins for if we showed up on time, if we were cooperative, if we were keeping our mouth clean, and if we were wearing our elastics. Elastics are a big deal. You got to wear your elastics. And so I know that sometimes I would be kind of on the lazy train for a couple weeks, but then right before my appointment, man, I was the golden child. I really wanted those coins because I wanted to win the big prize at the top of the shelf. Well, today kids are really involved in apps and electronic-based learning, right? Everybody has an iPad. Everybody has a cell phone. One of the things I recommend for my patients when they're just starting to brush their teeth or they're trying to change their oral hygiene habits, and this works for adults too, is play your favorite song and brush along to your favorite song. Because at that point, even if they only do half the song, they're at least at 2 minutes, right? But for kids, Dr. Zodi actually found the usefulness of an app in improving oral hygiene compliance in adolescent orthodontic patients, that patients did better when they were communicating and competing through an app-based approach. And he found that they had lower plaque index, lower gingivitis index, and lower incidence of caries. And so I found a couple really cool apps that I recommend for you to try, and links are in the blog, for your patients, and maybe set up a little competition chart in your office, because a healthy dose of competition, as long as it's preventing cavities, is always a good thing. 1 is Brush DJ, 2 is Brush Your Teeth with Funny Animals, and I just want you guys to check that out, even if you're a dentist or you're an adult, because I think you're going to get a good laugh at it. And Brushy's Little Monsters. And so there is plenty more app-based programs out there. Those are 3 that I thought were really great for kids and adolescents. And maybe that's a way to boost hygiene and make it hip in your practice. So I hope you guys enjoy and have an awesome week, and I wish you all the best. Happy brushing!